last one.
About
15 minutes
Okay.
for this one.
Can you hurry it up a little?
Oh, no.
Fighting cancer teaches you many things. Patience is one of them. Mike Britt is a patient. His team of oncology nurses at the Kimmel Cancer Center at Johns Hopkins takes very good care of him on treatment days because chemotherapy is a slow, careful process that takes hours to dispense. Patients and their caregivers are often faced with scheduling their lives around their chemotherapy appointments. Some of Mike Britt's chemo is required to be given at Johns Hopkins, but not all of it.
How are you, Mr. Britt?
I'm fine.
Can you verify your date of birth for me, sir? Where do you like it?
Mike is one of many patients now receiving some of his chemo under the watchful eye of the Johns Hopkins Home Care Group. Mike is carefully fitted with a special pump, primed to release a different chemotherapy before he leaves the cancer center for home.
The destination is on your right.
Home, where his favorite chair awaits him. Home is where a football game takes him far away from chemo world, and where Donna, his wife and caregiver, is faced with disconnecting her husband's chemotherapy pump, a task many of you may be asked to perform. The purpose of this video is to make the disconnect easy and safe, and Suwana Johnson, Hopkins Home Care Infusion Nursing Operations Manager, will take you patiently through the steps.
Chemotherapy at home. Now I know that sounds scary. And now we're asking you, the caregiver, to disconnect the chemotherapy at home. I'm Suwana, and I'm here to help you through that process and hopefully take away some of the fear and make this procedure safe and efficient for you and the patient.
Welcome to Johns Hopkins Home Infusion Specialty Services.
And remember, you always have the Johns Hopkins Home Care Group as backup. We're just a phone call away. First things first, wash your hands. Wash your hands. Wash your hands. I can't say it enough. It's so important to have a clean environment before you begin this disconnect. Wash your hands or use hand sanitizers. Prepare a clean work surface. This is just as important as washing your hands. No pets running around, the dishes are in the sink and nowhere near where you're doing the disconnect. And give yourself room to work. Preparation is so important for your safety and the safety of your patient. You don't want to have to run to another room because you've forgotten something. So gather your supplies and put them in the order that you're going to use them. Alcohol wipes, 1 saline syringe, the one with the white top, and 1 heparin syringe. More alcohol wipes, gloves, a red cap, and a white chemo bucket. Once you've done that, wash or sanitize your hands again. Unwrap your saline and heparin syringes and put them on the clean work surface. Then, put on your gloves. You've just completed the prep. Now it's time to begin the disconnect. Take the Dosi-Fuser out of the pouch. Look at it carefully to make sure the inner bladder is completely deflated. If it looks like the bladder is not deflated, stay connected and call PharmaQuip for instructions. It's important to stay connected until the 46th hour is complete, despite thinking the bladder might be empty sooner. With the deflated inner bladder, close the slide clamp on the tubing of the Dosi-Fuser. Remember, the hard plastic end of the chemo tubing is taped to the patient's body. Carefully remove that tape so that the connection from the chemo tubing to your central line is visible. Before you disconnect your chemo tubing from the end of the central line, make sure it's clamped. Disconnect the chemo tubing from the end of your central line. It's important to hold onto the end cap when disconnecting the tubing to make sure that the cap remains on the central line. With your white chemo bucket close by, place the red cap on the end of the Dosi-Fuser tubing and place the entire Dosi-Fuser into the white bucket. Take off your gloves and put them into the chemo bucket. Wash or sanitize your hands again. And then put on new gloves. Scrub the end of your central line with an alcohol wipe for 15 seconds. Flush with the saline syringe and discard the empty syringe into the chemo bucket. Scrub the end of the central line again with a new alcohol wipe for 15 seconds. Flush with heparin and place the empty syringe into the chemo bucket too. Then clamp the central line. This is the final step of the disconnect. For patients with a Metaport, we need to remove the Huber needle. First, gently remove the transparent dressing and place it in the chemo bucket. Then simultaneously squeeze the wings of the Huber needle and pull away from the chest. The wings will collapse to cover the needle to protect you. All of that goes into the chemo bucket too. Then bandage the port if needed. Take off your gloves and put them into the chemo bucket. Wash your hands. Wash your hands. Wash your hands. Wash your hands again. Yes, we ask that you wash over and over again, but this is to ensure you and your patient are safe during this disconnect process. The disconnect is now complete. You've taken all the necessary precautions to make sure the patient has received the prescribed chemotherapy, that the medication bag and the tubing has been properly discarded in the chemo bucket, and now the chemo bucket is ready to be picked up. Johns Hopkins Home Care Group is available to answer any questions or to walk you through this disconnect process. Please don't be afraid to call anytime. We are partners in this battle against cancer at Johns Hopkins and at Johns Hopkins Home Care Group too.